Good evening, my name is Glenda Earles and I attend the Minnesota School of Business in Rochester, Minnesota. And in the next few minutes we will be discussing the pros and cons of having free healthcare in the United States, who will be impacted the most if the United States were to have free healthcare, and should healthcare be a right or a privilege for the citizens of the United States. So let's talk about the question of the day. Should the United States have free healthcare for all its citizens? Well, as a healthcare provider, I know that this is a very hot topic. People who don't have the correct insurance, unfortunately, don't get the treatment that they need. People who even have insurance but don't have enough coverage will not receive the treatment that they need. They will not be able to stay quite as long as everyone else to get rehabilitation. And they certainly will not receive all the medications or the same medications that everyone else gets, depending on what their insurance. So unfortunately, if you don't have top-notch insurance, you may be sitting on a time bomb, because if you need treatment and your insurance will not cover it at this time, you will not get it, and your provider will not give it to you. So let's start talking about why healthcare is so unaffordable for businesses and individuals. Businesses have gone as far as to change the rules on what is considered full-time hours to reduce the amount of employees that they have to offer health insurance to. We can eliminate the wasteful inefficiencies and duplications of paperwork, the long wait for claim approval, the insurance submission. And I don't know about you, but I have filled out this paperwork several times, and it can be quite confusing. If you check the wrong box by mistake, your claim will not be paid, and you will have to start over with the process. And during this time, while you're waiting for your insurance to pay that bill, you are being charged interest. Even though you are waiting for the claim to process, the clinic or hospital will charge you interest. I myself had surgery a few months ago, and it took 9 months for my insurance to decide exactly how much they were going to pay for that surgery. During that time, the hospital was adding up the interest on that surgery cost. And fortunately for me, I have top-notch insurance, and they paid 100%. Unfortunately for many others who don't have good insurance, you will end up paying that interest penalty. And that unfortunately is unfair, because that is you're paying that because your insurance company took too long to pay your benefit out. If right now, if you have to change your PPO or your HMO, depending on where you live or depending on where you work, you might lose your current healthcare provider who has treated you for years and knows every little thing about you. Unfortunately, when people have to switch providers because of their insurance, they get lost in the system. And people who have extreme medical needs like diabetes or rheumatoid arthritis, who need to be seen on a regular basis, get lost in the shuffle. And they're months out to see a new provider, and in the meantime, their prescriptions run out. They are unable to get new prescriptions because the pharmacy won't give them any medications until they see their new doctor, whom they're waiting to see but cannot get in to see because several other people have had to switch due to the insurance. Unfortunately, many people die because of this, because they couldn't get in just for an annual physical to see their new provider that their insurance says, this is the provider you have to see. Unfortunately, people are currently unable to get preventative care because they can't afford it. And also because preventative care sometimes is not as easy and accessible as it probably should be. I know firsthand from working in healthcare that in order to get a mammogram or a colonoscopy, if you are under the guideline age, which is usually about 40, you have to have a letter from your doctor. You have to call the insurance company. You have to tell them why you need to have this done, plus have the letter, and then maybe, just maybe, they might let you have the preventative care that you need. This is ridiculous. Who lines up to have a colonoscopy done or to have a mammogram done? I don't know anyone that says, hooray, I get to go in and have a mammogram or a colonoscopy. Insurance companies, I understand, don't want to pay for things that do not need to be done. But these two tests, for example, are usually not done unless they really need to be. People don't just go and have them done for fun. Unfortunately, people who have to wait for their insurance companies to say yes or no, who are truly sick and need these tests done immediately, could go from stage 1 cancer to stage 3 in the matter of weeks while they're waiting for their insurance to decide, should we let them have this test done? If the government were to give us free health care, preventative medicine would be mandatory, and you wouldn't have to wait weeks and weeks to get the insurance companies to say, yes, you can have a colonoscopy, or yes, you can have a mammogram, because when the government gives us free health care, they want us to do preventative care so that way in the long run they won't have to pay out thousands of dollars. They'd rather pay out hundreds instead of thousands, which makes a lot more sense. So now let's talk a little bit about why the American people should not have health care insurance given by the government. Well, some people say that it's not free, and they're right, it is not free, that we'll be paying for it with our taxes. Our taxes will go up, and that there will be cuts in education and in the defense. Well, this is already happening. Every year they cut from the defense. Every year they cut from education. Every year our taxes go up. So I'm not sure how this will be any different than if we don't do anything at all. The healthcare industry may likely become infused with corruption. Well, this might be true, but I'm sure this stuff happens all the time already. As we know, the government is not perfect, and we hear all the time about the corruption on Capitol Hill. So I'm not sure what would be the difference between corruption in healthcare and corruption on anything else that goes on at the White House. Nonprofits and government-run hospitals, yeah, they do, like I said before, provide health care to people who don't have health insurance, but then again, they're going to get charged that bill, and they're going to garnish your wages, they're going to put a lien on your house, they're going to do whatever they can to get their money because you don't have health insurance. So let's talk about who are the major profit insurance companies in the United States. Well, we all know the good old Blue Cross Blue Shield, who's been around since the 1920s. Blue Cross Blue Shield is for-profit insurance company. They'd be dumb not to be. They deal with like all other insurance companies, they deal with the law of large numbers, and they seem to be doing pretty well for themselves. We also need to talk a little about the United Health Group, which was founded in 1970. They do pretty good for themselves. Aetna, which was founded in the 1930s. And last but not least, our newly insurance is Humana, which is a Medicare insurance that people are switching to nowadays. So now let's take a look at our people, our neighbors of the North, who are managing free healthcare to the Canadian citizens. Canada spends roughly about 60% of what the United States does on healthcare, and they manage to cover everyone. In the public system, spending less does not mean worse healthcare outcomes. Measured by life expectancy, infant mortality, cancer survival rates, and other measures, Canadians enjoy the same, if not better, levels of care than the American people. Public health care costs less, delivers more, and is for everyone, regardless of their ability to pay. In Canada, core hospitals service can only be non-profit. A large single system means that the share of health spending that goes towards administrative costs is only 16%, compared to the 31% that the United States is currently paying out. I think we could learn a little bit from our neighbors to the north. They cover everything as long as the procedure is not purely cosmetic. If you just want to have a touch-up done, it will not be covered under your free healthcare. But if you need to have cosmetic surgery due to a disfigurement, then it will pay, which honestly makes sense. If you want a nose job, you should be able to pay for it yourself. Do we have a good healthcare system in place already in the United States? Many of us think so. Addressing the American people worldwide concerned about the potential negative impact of the health reform. I looked it up, and it seems like actually Hawaii is the healthiest state in the United States of America. I think we all should move to Hawaii because they seem to be doing it right over there. Healthcare, it provides an opportunity to build strength and the current weaknesses in the United States, working towards aims to improve what care provided is safe, effective, patient-centered, timely, and efficient. We don't just want to have timely and efficient healthcare. We want to have healthcare providers that care, healthcare providers that know our names, healthcare providers that don't take 2 minutes and look at your chart and hope that they're giving you the best care. If the American citizens could have free health care, people would be able to get treatment that they need, the help that they need to get healthy. Unfortunately, everything costs money, and if you don't have the money to join that gym, to go to the tobacco cessation clinic, to do whatever you need to get healthy because your health insurance won't cover it, then it's really difficult to get healthy again. So in my opinion, even though I have great insurance, and so do all my children, thank goodness, but I think American people should have free health care insurance because preventative care is so important and it's life-saving. And what's better than that, than to save a life? So I will end this presentation, and I hope you all have a great night. Thank you.